I'm very excited to welcome today to the Editor's List podcast, Raj Kanodia, an old friend of mine and one of America's most respected rhinoplasty surgeons. Raj is based out of Los Angeles and has a coterie of Hollywood megastars who have all sought his expertise. He is known for his incredibly high standards in rhinoplasty, and we're going to be exploring exactly what he does with his work and what sets him above everyone else. Raj, welcome. Thank you for talking to me.
Thank you for having me.
Raj, you are known as a pioneer in closed rhinoplasty. Please can you explain the difference between closed rhinoplasty and open rhinoplasty and the different issues that they address?
Fabulous question. I absolutely love to distinguish between the scarless rhinoplasty and the other term is closed rhinoplasty. So closed or scarless means you're working through the nostrils, and yes, you do make incisions, cuts, but they're made inside the nose and they're never visible. And I would say as high as 98% of the noses for the first time should be done scarless closed rhinoplasty. The reason being that there's no reason to inflict a scar at the bottom of the nose.
What kind of adjustments are you making when you're doing your scarless rhinoplasty? What kind of problems can you correct?
With my approach to rhinoplasty, so the nose is the center of the face. And when I look at the face, I look at it as a painting. And that was the fascination I had. I wanted to look at the painting and improve the painting. And the center of the painting is relevant to the cheekbones, relevant to the bone structure. And if there are any blemishes in the painting, you want to restore it, you want to enhance it, you don't want to change it. So I look at pretty much every nose and every face as that's a very important Rembrandt, and that I can't change it. Mm-hmm. What God did and the parents did for the patient or the child, I want to improve on it, and yet do not take away the character of the painting. So the first thing first, you have to recognize what's beautiful. And every nose has some beauty inherent to the nose.
An individuality about it that you want to preserve.
And that's the character of the person. That's the character of the family. So you want to preserve that. And typically that is in the tip of the nose.
Right.
The tip nostril complex, because the tip and the nostrils and how they attach themselves. So that's the first thing I have to recognize. And I would say as high as 50% of the noses I do, I say, wow, that's beautiful. And I want to preserve it. And by doing so, I want to fool everybody, including the patient, that I did any serious alteration. I don't want to change. I want to enhance. I want to refine, because I look at it again as a painting. So let's say the tip is perfect. I decide the tip is perfect. All we need to do is file the bump down a little bit so we can shave the bump down and we're done. Sometimes we need to just lift the nose because it's long. And every time the patient talks or smiles, the nose comes down. You want to pick it up just a little bit. You can do it from inside.
Are you shaving the bone inside? What are you doing to pick up a tip?
Pick up the tip, you have to shave the cartilage at the bottom, and you have to relax the muscle which is responsible for bringing the nose down, and that muscle is called depressor nasi. So you make a couple of little alterations, and that's what allows you to lift the tip. Now we talk about the bridge of the nose. If it's too strong, if there's a bump, either due to trauma or due to the fact that that's
genetics.
That being the case, you can go in through the nostril, file the bump down like you're filing a nail. In a nail file, we call it rasp. We file the bone down and the skin just molds to the new framework. And my goal is day 6, when I take the bandage off, that person should be able to go out either to school or to work or go out for dinner with the family 6th evening, and nobody should know that anything has been done. Let's go back to the open rhinoplasty approach. When you cut it open, there's reconstructive mentality. They are adding cartilages. They're changing the entire shape. It's 4 to 6 hour operation. There's tremendous amount of swelling. You almost hide in the closet for 6 weeks before you can go out. I mean, don't understand the mentality. And the reason the pendulum has swung so much to the open approach was this was a teaching tool. To learn the scarless rhinoplasty, it's a tremendous learning curve. And the student has to spend a lot of time observing the surgeon, months and years, because the surgeon has to move his shoulder, his hand, let the student observe him, and then get back to work and let him observe. So it's not like a continuous observation. So there's a big learning curve.
So it's a lot harder to learn about the scarless or closed rhinoplasty than it is with an open rhinoplasty, which is obviously a lot easier for surgeons. I'm calling your technique the secret Hollywood nose job because it's so discreet. There are no scars. There are lots of very beautiful women walking the red carpet right now that have had the procedure that we wouldn't really know have had it. And it allows people, I guess, to have shorter downtime, which in Hollywood, where you operate, everyone is out there being photographed. They have a lot of people are in front of the camera a lot of the time. So I guess that's very important. You can't take 6 weeks off to let the bruising subside. But I was picking up when you were talking about younger people. What is the average age? I mean, how young will you operate on? Will you operate on a teenager for rhinoplasty?
Yes, I do. And I'll give you the reason why. At 14 and 15, a girl or a boy will come in with the parents, with the older sister. Older sister is famous. She's beautiful. She's successful. And the younger sister, because of the bump or because of whatever she feels is not perfect about her nose, she's depressed. She's anxious, and they have to go to psychiatrists to get antidepressant and all that pills they're taking because she's not able to confront the world or face the world with the way she feels about herself. More so nowadays because they look at their pictures. They compare themselves to celebrities. They compare their incidents. They compare themselves to the sister who's had it done 3 years ago. I say, oh my God, my sister looks so beautiful. Why do I have to wait? I need it now. And so there's a dilemma for the parents and for me. And the dilemma is, should we subject the 14-year-old girl to the nose surgery? And my answer is yes. I would rather give her the confidence, give her the tools to go out and conquer the world and not have to deal with pills and not have the psychological issues between the sisters and the brothers and the family and the friends. Because kids are cruel. And now, apart from the kids making the comment that, what about that nose? They are self-analytical and critical. They look at their selfies, they look at the pictures, Everybody's shooting everybody's pictures nowadays. Mm-hmm. And so that tells them that they need to do something about it.
At the age of 14, is it safe to do this when you're such a young age? I mean, has your nose matured?
So that has been quite contradiction between leading authorities in rhinoplasty. One of the first ones to decide that yes, it has grown, and yes, it is absolutely safe to do it at 14. Boys probably at 15.
Why?
Because boys take a little bit longer, and as far as the growth of the nasal bones are concerned, it's done at 14 for the girls and about 15 for the boys. Now, there are very rare exceptions. The cartilage, the tip cartilage, the upper half of the bones, upper half of the nose is bones, and the lower half is cartilage. Cartilage moves and the bone does not. So if you feel that the bones are strong enough and cartilage, the matrix, the texture of the cartilage is strong enough, then 14 is the correct age. You can do it.
But you have to do it on a case-by-case basis.
Yes, and that's why, as I said, most of the patients at 14 and girls, they're ready, and I do several 14-year-old girls, and I do several 15-year-old. Leads to dilemma. Sometimes I'll do a 14-year-old and the mother will bring the 12-year-old, my 12-year-old ones. I said, no, now there's a limit. Right. You have to wait till 14. So I think 14 is where I see the cutoff. And that's the thing, you want to create the confidence. You want to give them that confidence so that, yes, I'm beautiful. When they look at themselves, and when you feel that way, you look at yourself in the mirror and you feel that way, that yes, I'm beautiful, you can conquer the world. And that's what I want to give them, that confidence. But I want to get to one point, is that when the open rhinoplasty technique, the surgeon, he opens the nose, peels the whole skin, he's looking at the anatomy, the bone and the cartilage, and he gets into this reconstructive mentality. Now that I have it open, let's do some grafting, let's do this, let's change it. So they're into a totally reconstructive mentality, changing the nose. That's not an option. On really beautiful noses, that's not an option. You have to preserve and you have to enhance and subtly refine what needs to be refined. Nobody wants a completely different nose, and that's what they end up with open rhinoplasty. It's 4 to 5 hour surgery, and many primary first-time nose jobs with very famous open rhinoplasty surgeons. Why do they take a rib and reconstruct their tip? That's nonsense. There's absolutely no reason to take a rib to rebuild the tip or reshape the tip on a 14, 15, 16-year-old patient who has a gorgeous tip to begin with. So that's my biggest contradiction and conflict with the open rhinoplasty surgery. Because A, you're inflicting a scar. B, yes, you're doing so much alteration to the nose that the patient does not look like themselves anymore.
So you're doing much more refined, subtle tweaks to the nose and trying to keep the character of the person's face. And I guess it's very appealing to your Hollywood clients because also the downtime is not so bad. Will you tell us, after you've had this surgery with yourself, how long until you can go out and about in public?
Day 6, I want my patient, I take the bandage off in the afternoon and I want them to go out
to Nobu
that evening to Nobu Malibu.
Your favorite restaurant.
My favorite restaurant. And as a matter of fact, this summer, I was able to, a lot of patients, I feel very honored and humbled that they would come from all over the world. The family has to come because their young daughters are coming. So the whole family, mother, father, sister, all these people are coming. And if I have a connection and they have a connection with me, I want to entertain them. I want to say, thank you for trusting me. Thank you for coming and showing me the respect. And the day we unveil, we go and celebrate the nose. I think less trauma inflicted, better the healing, more natural it is. And that's what people are looking for. And looking at what the celebrities want, that's what regular people want also. So I use the same standards for what I'm going to do for the celebrities. I'm going to treat every patient as a celebrity, and I want to give them the nose which will fit their face, and yet it doesn't look like a different person. And the most important person is the patient. I want her to look in the mirror day 6. As soon as I take the bandage off, I get so excited. I say, look at it, look how good it looks. And I want to see that smile on the face. And I get letters and notes from people I've done 30 years ago. Now their children are coming to me. 20 years ago, now their children are coming to. I did the husband and wife 25 years ago. Now I'm doing the 2 kids, So that's excitement because you build this relationship and you're not changing. I think there's certain noses which are really broken and tremendous injuries. Yes, they need a change. But most of the noses we see in the world, they don't need change, they need refinement.
And what about, because obviously when you have a rhinoplasty, you have to be very careful about the breathing functionality of the nose as well. Is it safer to do this closed rhinoplasty with the breathing function than peeling a nose back and adding cartilage from the ribs?
Well, the septum, which is the third wall, the 2 outside walls we can see and feel. The septum is when you put your finger in the nostril, you can feel the septum, that's the cartilage. And half of the septum is cartilage, half the septum is bone. So out of the 10,000 noses I've done, out of those 9,000 I've done septum. And the septum, this is another important thing. Not only you want to straighten the septum, and I would say 90% of the people have deviated septum. It could be 10% deviated, 20% deviated, which means the obstruction is 20%. So if it's 20%, you don't need to fix it.
Right.
But if it's anything more than 30 to 40% deviation, I suggest it, or the patient asks, I want to give them a better breathing. Because in yoga, they say life is breath, and the breath is the one you take through the nose, and it is.
Raj is now doing an amazing yogic breath. He is of Indian origin and he is incredible at yoga. I've been to his house many times and I know that you're really into it. So you are very focused on your breathing.
And what a gift. So nose has a function. Every cell in the body needs oxygen. And the best oxygen you can take in and deliver it to all your cells is through the nose. If you breathe through the mouth, the cells do not get the same level of oxygenation. So I want to give them better functionality. Nose is responsible for better breathing. It's responsible for taste. When you have a really bad cold, you can't taste your food. If I give them a better breathing, they taste their food better. Their endurance is better. So the athletes come back and tell me that they have more energy. And their functionality, their functions, their athleticism is better. What else? Singing is better. So a lot of musicians, singers I've done, they have gone back and redone their voice recordings because the nasal intonation is less. When the nose cannot breathe, the sound is also obstructed. The nose is the reverberation chamber of the sound. And when we clear the breathing, then the sound is better, the singing is better. Now, one more important thing. When you do the septum, you can take the broken piece of the cartilages, and with one of my teachers about 35 years ago, we created this called spreader graft. And it has the same effect as the Breathe Right tape when you pull the nose. You see a lot of the athletes.
Yeah.
So instead of throwing those broken pieces of cartilages, I straighten them and I stitch them into the valve. It's called spreader graft. So I open it up for them, and the rest of their life they have better breathing. So I'm improving the functionality, and as I said, function is not only breathing, it's endurance, it's sleep.
Taste, very important.
Taste, it's singing, everything is related to nose. Nose is a very, very important structure.
Well, they're very complex, and I think it's fair enough to say that it's one of the hardest, trickiest surgeries to get right. And do you see a lot of revision cases where people have had botched jobs and you've had to go back in there and try and fix it for them?
I do not like to do revisions. And the reason is the tissue is not as pliable and it's not as elastic. So I'm always less than satisfied when I do a revision. And I came to that conclusion about 30 years ago. And so I said there are surgeons who are better than me for revisions. And in those cases, you can justify the open rhinoplasty because one has to open it and look at all the distortions and the scar tissue.
Yeah.
And so that's the only place where I would say open rhinoplasty is justified by a skilled surgeon. So I am not an expert on revision rhinoplasty.
So you've got to get in with you early. Bring your teenager, come in your 20s or any age, but you prefer to do first time rhinoplasties.
Only.
Okay. And can you just tell me, how does the nose age? So, I mean, like a facelift, you have your facelift and the surgeon says, right, this is going to last 7 to 10 years. Does a rhinoplasty have a shelf life?
It lasts for life. The reason being that the framework of the nose and the skin attached to on top of it does not change. The only nose and there lies the myth that the nose constantly grows, is a nose which is long, dependent, and hangs down with smile. So the elasticity will make it look like it's growing downwards towards the lip. But a nose which has got a beautiful angle and which is not turning downwards never grows. And there's I'm very fortunate because the noses I did 40 years ago, 35 years ago, they're coming back with their children and I'm able to see them. So I see my follow-up from 30, 35 years ago. And so that answers our question that, is it lifelong? Yes, it is.
Fantastic. You're in the middle of Hollywood in Beverly Hills. Small ski jump sort of noses seems to be a thing of the past. What kind of noses are your millennial clients looking for now?
Well, the millennials are very in tune to my concept being not to change noses, is just to subtly refine. So that's why they dial into me and I dial into them, because our concept is the same. Right from the beginning, that was my concept. I had 3 of the best teachers in the last 60, 70 years. Dr. Tardy from Chicago, Dr. Parks, and Dr. Sheen in Los Angeles. So I'm very fortunate, because nose was my passion, and I was lucky enough, and God blessed me with the 3 best teachers to learn rhinoplasty from. And I learned from each teachers, but my concept was, again, I look at nose more like beauty. I would say scarless close rhinoplasty. Mm-hmm. Yes, you need surgical skills, you need experience, but I think 70-80% of it is all art.
It is. I mean, I've actually been in the operating theatre and I've watched you do one of these noses. You had to give me some smelling salts to bring me round. There was no blood. It was more the sound effects I could hear of the sort of refinement of the bone, but it was incredible what you had done. And I was just very surprised by the fact that there was very little swelling and bruising, and your patient just wore a cast for 6 days.
6 days.
And that was it.
And I lose less than 20 drops of blood, because I do a lot of things. I ice the patient beforehand, I prepare them with arnica. Even when they come from abroad, we send them arnica. I used to take arnica for 1 week. And before we do the surgery, this is very important, these are young people. They have never had any medicine.
General anesthetic.
So their system is really pristine and clean. So we want to treat it like that. So what we do, we start the IV, and through the IV, we don't give them 100 of this, 100 of that, and knock them out and start the surgery in 5 minutes. No, we don't do that. We treat them very delicately and give them 5 milligrams, and we are icing their whole face for that 1 hour plus, and take them down slowly. They're happy and they're very...
So it's a very, very sophisticated sedation method that you use. And yes, I remember there were lots of ice packs going on the face. So there was very, very little swelling.
Before surgery?
Yes.
Before surgery.
Yes,
and that's so critical, because my goal is day 6, they should have no bruising. And I would say as high as 50% of my patient, even if I shift the bones, break the bones, and straighten them, they get no bruising. Let's say the surgery is scheduled for 8 o'clock. The patient arrives at 8, and they're changed and the monitors are hooked up and the IV started. That process takes about 15 minutes. And then with slow anesthesia and the icing, we'll probably start the surgery at 9:30. Then they're fully asleep. And with septum and fixing the breathing and doing the cosmetic work, my average is 1.5 hours.
Wow, super quick.
Because least amount of trauma inflicted, icing before surgery, during surgery, immediately after surgery, because the goal being they should be able to go out day 6. The moment I take the bandage off, I want them to go out and enjoy life.
Thanks so much. It's been amazing talking to you, Dr. Kanodia. It's always a pleasure.
It is my pleasure.
The editor's list provides unbiased information to those that may be considering cosmetic surgery or using a non-invasive treatment or product. The editor's list does not endorse the use of any product or procedure featured in this podcast, and we are not responsible for the outcome of any of the treatments, procedures or products featured on this podcast, or damage caused in connection with the use of any of the treatments or products. Should you decide to try any of the procedures, treatments or products mentioned in any episode of the Editor's List podcast, you do so at your own risk. Always consult an independent and fully qualified medical professional if you are considering embarking on a medical procedure, irrespective of whether it is an invasive or non-invasive procedure.